idea of the kinds of things that I think are important, more important than others now. I might even try to word some questions like I might word them on your exam. Okay? All right? So anyone have anything to say before we get going? Okay. So this is slide 32. Okay, this is a coronal section to the cerebrum, right? And so on a slide like this, you should see that there's a left side and right side. You should remember that the white matter staying dark, the gray matter staying light. So we see some cortical tissue with out here on some of the surfaces, okay? And you can see that there's white matter core beneath the cortex. Certainly, I think you can see the same corpus callosum connecting the two hemispheres. On the bottom edge of midline, the corpus callosum, remember the septum flucidum, and the fiber tract that occupies the position here along the inferior margin of the septum flucidum are the left and right fornix. Remember, which originate out from the hippocampus here, which is this cortical tissue that you see in the floor of the fourth ventricle. Remember that on each side of the septum flucidum, with the lateral ventricle, this is the body of the lateral ventricle on the right side and left side, caudate nucleus, which is part of the basal ganglia network, as you know. Down in the core of the cerebrum, you should recognize that this is the area of the gynocephalon. It has two halves separated by a third ventricle here. Hypothalamus is the inferior part of it. The mammary bodies, that should tell you about what the section is made into that line. Above the hypothalamus, most all this territory through here is the thalamus, with the right half and left half connected by the mass intermediate. Internal capsule. Good view of the internal capsule. This is the part of the posterior limb of the internal capsule. And you can actually see some of the fibers here as they get to the bottom of the internal capsule, preparing to leave the hemisphere. They're starting to collect here to form the cerebral cruise, which is going to become a structural element of the midbrain that we'll see on the next slide. So again, internal capsule. Remember, lateral to the internal capsule are some important nuclear territories that are part of a motor control circuit, but also there are neurons here that play a role in addictions and seeking pleasure and things like that we did not talk about. But the lateral part of this nuclear territory is made up of the putamen and the inner bands here. In the human brain, there's usually three bands, 1, 2, 3, of neurons that make up the globus pallidus. So we see putamen and globus pallidus. Superficial to that, you see the cortex of the insula, and the lateral sulcus is the outmost territory. And again, I think the final thing would be, again, here's part of the temporal lobe with some cortical tissue that's in the floor of the inferior hornal lobe. So technically, this is part of the hippocampus or the hippocampal formation. So again, major on this slide would be mostly just identifying a major structure. So slide 24. Again, you should be able to recognize that this section on 24 represents a section to what part of the brain? Midbrain. Again, major anatomical landmarks include the cerebral aqueduct with periaqueductal growth. You can see the area here of the cerebral peduncle. I think you know by now that in the cerebral peduncle, you need to recognize this big bundle of white matter, which all descending fibers descending out of the cerebral hemisphere. You should be able to identify the structure as the cerebral what? The cerebral groove, or true cerebral. Again, I'm not as likely to ask you what kind of fibers fill the middle 1/3. You already know that. That's pyramidal fibers. Here, cortical pontines. But remember, there's other descending cortical fibers mixed in the cerebral groove besides those fibers that I mentioned. You should be able to identify the position of a major nuclear complex here, which is part of the basal ganglia network, which is called the substantia nigra. Filled much of this area through here is substantia nigra. Certainly, you should by now know that the cranial nerve that exits out of the midbrain through the intervertebral fossa, which is here, is what cranial nerve, that's the third nerve. So there's oculomotor nerve. So this section, because it shows oculomotor nerve, goes along with the superior colliculi. So at this slide, 24, there's the superior colliculi, the major landmark. Now again, if this is third nerve, I've told you that I would expect you could kind of see that, hey, some of these axons that are going to eventually exit from here to form a third nerve, you can see some of these axons which have yet to exit. If you follow these dark streaks back, they lead to not a well-defined, but sort of well-defined nuclear slide, the oculomotor nucleus complex, and that goes along with the third nerve. And again, in lecture, you might have to know about the part of the oculomotor nucleus complex that's made up of primarily preganglionic parasympathetic neurons whose axons help to make up the third nerve, and that's the epigastrial nucleus. You don't see it here, but that epigastrial nucleus is the oculomotor nucleus of this complex. Okay? I mean, it's possible I could ask you the position of a major ascending somatosensory pathway that dominates this area through here, and that would be what pathway? The medial lemniscus. Remember the cornucopia here, and the medial lemniscus is the white part of the basket. The tapering into the basket here, that's where the spinal thalamic tract is. And again, I could ask you that, but that maybe gets a little bit off use. So this is another section I think you should be able to write down as midbrain, slide cartoon 23, page number 23. Again, key here is cerebral aqueduct and a very nice distinctive periaqueductal gray. If you see those structures, generally you're in the midbrain. And although there is a little bit of pons here, some of the basilar part of the pons was grazed by the section. Again, this structure goes along with the midbrain. This is cerebral cruise, and the major, mostly motor control group of neurons that form the nucleus here. This nucleus is the substantia nigra, so you can see substantia nigra. Now again, on this slide, I think one of the distinctive features compared to the previous slide of the midbrain, again, this is slide 23, is the decussation to the superior cerebellar peduncle. And at the level of the midbrain where these peduncle fibers decussate is at the level of usually the inferior colliculi. So I know that this is contrary to what he labels these colliculi in the atlas, but it's the bottom edge of the superior colliculi. But I always think of them as inferior colliculi because they go along with these decussations. And what goes along with both the inferior colliculi and the decussations is the cranial nerve nuclear pair, one here on the right and one on the left. And these are a very small group of neurons, but they innervate only a single muscle of the eye. And what nucleus is this? But this is the trochlear nucleus. So if I pointed to something like this, I'd probably just say, hey, name the specific nucleus right here. Okay, that's the trochlear nucleus. Again, you can see suggestions of a white matter pattern here that cornucopia and medial lemniscus fills much of this territory through here. Spinal thalamic tract fills much of this white matter area through here. And the trigeminal thalamic tract is along this region of that area. Again, some of that becomes a bit difficult to ask. So major structural things, along with the trochlear nuclei on this slide. Now, you ought to be able to recognize that this part of the brainstem is dramatically different from what we've been looking at. Again, it's very big. My eyes attracted to all these decorating fibers. This is slide 19, by the way. And it's upper pons. And so you should be able to know that it's pons because it's pons, because you see all these pontocerebellar fibers that are very typical of pons. Remember, these pontocerebellar neurons originate from pons nuclei. So most all these gray matter areas between the fibers are pons nuclei. Again, the pyramidal fibers are going through the basilar pons in fascicle-like bundles. So that fits with being pons. So here's pyramidal fibers. Again, there are other descending motor control fibers mixed in here as well. Unfortunately, he included a slide where the middle cerebellar peduncle has been trimmed up, right? It's been trimmed, but again, you can see middle cerebellar peduncle, which goes along the pons. So you should know that this is fourth ventricle. I could ask you that. And in the lateral wall of the fourth ventricle, this being the upper pons, slide 19 is upper pons. These are superior cerebellar peduncles, which are going on upstream in the midbrain, and we saw on the previous slide they decussate when they go into the inferior part of the midbrain. Okay? Now, on this slide, upper pons, again, there's a couple cranial nerve nuclei here that we've identified for quite a while that I said I'd like you to be able to remember. This is the level of pons where the fifth nerve comes in and out of the pons. And at that level of the upper pons, this nuclear territory makes up the chief sensory nucleus, the fifth nerve, also known as the pontine trigeminal nucleus. I think in the atlas he calls it the principal trigeminal nucleus, and that's fine too. These are secondary neurons with the fine touch and vibration and proprioceptive pathway for the inside phase. And then medial to that, more recently in the third part of the course, when we reviewed cranial nerve, we talked about the trigeminal motor nucleus. So these are lower motor neurons of the trigeminal nerve located here. And they send their axons out to innervate the muscle, mastication muscle, or other muscles. So on this slide, there are two major cranial nerve nuclei that you should be able to identify. The chief sensory nucleus, the fifth nerve, and the trigeminal motor nucleus. Again, if I were to ask a question like that, I would likely just say, hey, name the major nucleus that dominates this area through here. Okay, you'd have to know it. Okay. Again, it's pons, so we talked about this earlier in the course, that some of the major somatosensory pathways carrying information from the body ascending through the pons, they form that whale-like structure through here, this white matter area. The head and body of the whale is the medial meniscus. The base of the tail of the whale is the spinal thalamic tract. And the trigeminal thalamic tract, which is carrying information from the face, is along the back of the big body of the whale through here. So in any event, this is upper section through the upper pons, and there's several structures there. This is kind of a landmark slide as well, but it's really much lower pons. It's just above the medulla. And again, you should be able to tell if it's pons, and I can ask you just name this part of the brainstem that's represented by this section. Pons is all I'm looking for. You don't have to say lower pons, just pons. Again, you can see pontocerebellar fibers depositing. I think that's a key landmark type feature that allows you to tell this is pons. Again, you see the middle cerebellar peduncle has been trimmed up. You can kind of get the idea that these pontocerebellar fibers are going into that middle cerebellar peduncle back to the cerebellum. You can see a pretty big fourth ventricle. So we're lower down in the pons than we were in the previous slide because the fourth ventricle is wider. You can see actually not only the middle cerebellar peduncle, you can see their superior cerebellar peduncle here and here. And you see the uppermost part, or at least part of the inferior cerebellar peduncle. Part right here, and there's some right here, inferior cerebellar peduncle. Now, again, in the lower pons, you should expect to see, based on what we said previously in lecture, that there should be some vestibular nuclear complex, because vestibular nuclear complex is really big. It's present in the lower pons, actually right here in the lower pons, and then extends up downward into the upper medulla. So we'll see that on subsequent slides through the medulla. So again, vestibular nuclear complex. Now again, because we're below the chief sensory nucleus of the fifth nerve that we saw on the previous slide, if I went back here. So here's the principal trigeminal nucleus right here. Remember, below this level, when we get into the lower pons, we pick up a nuclear column that's part of the trigeminal sensory nuclear complex, and it's a nucleus called the spinal trigeminal nucleus. And so there's a little bit of spinal trigeminal nucleus here, and then right next to it is the spinal trigeminal tract. And we're going to follow this spinal trigeminal nucleus all the way down from here, the lower pons, through the entire length of the medulla. Okay? Now, finally, with regard to this slide, perhaps the main reason that it's in this collection of slides I'm having a look at is that this is the landmark section that shows two major cranial nerve nuclei, one here and one here. And I think now we remember that I've given you a name for this landmark, which neuroanatomists always well know. It's called the facial colliculus in the floor of the fourth ventricle. But remember, and you will, I'm sure, that even though it's called the facial colliculus, what nucleus dominates that colliculus? That's the abducens nucleus. So these are lower motor neurons that send their axons right down through here. These are the axons, these lower motor neurons, the abducens nucleus. And they're going to exit just off midline as a sixth nerve at the complementary junction. So I think, again, there's kind of a hint here as to what that nucleus is, the abducens nucleus. So what muscle guide are these fibers innervate, but the lateral rectus muscle. So, again, on this slide, though, there's this other nucleus here. And I can ask you, hey, name this nucleus that dominates this area here, and that's the facial motor nucleus. So these are lower motor neurons whose axons, we said earlier, travel posteriorly, medially, and these are some of them right here. And then they curve over the top of, they travel over the top, superficial through the abducens nucleus, and they come back out, finally, at the motor root of the subject nerve. So these are lower motor neurons of the facial nerve that make up the facial motor nucleus. Or you could call it the seventh motor nucleus as well. And they innervate all the muscles of facial expression on the lateral plates, plus three other muscles, which I'm sure you know. So again, on this slide, I think pretty important is the abducens nucleus and the facial motor nucleus, but there's some other cranial nerve nuclei out here as well. Now, it might be worth pointing out that most of these slides, I think virtually all the slides being on the test, every slide would have at least one question. Some slides will have two questions, but I don't think I'll have any slide that needs to have 3 or 4 questions. So if that gives you an idea of how the pace of the questions might go relative to the slides that you're responsible for. Which slide was that? That previous slide, I'm sorry, was 17. Thank you. Sorry. We doing okay? Is it helpful, you think? Okay. So we go to this slide, folks. And again, the one question will be named a section through the brainstem. So you might as well get it right. What section? This represents a section through what part of the brainstem? It's medulla. It's pretty obvious. You should know that well. And again, why is it medulla? Because what's this structure right here? Why is it medullary pyramid? What's wrong with this one over here? Well, that's a scar. We talked about that. This person suffered a stroke in life, and so this is a scar. The fibers that made up this pyramid is gone. Okay. So there's a pyramid. Then we have this structure right here. Name this big nuclear structure right here. It's not just the olivary nucleus, it's the inferior olivary nuclear complex. So the inferior olivary nucleus, okay, is what we're looking for here. Now again, in medulla, I think it's important for you to know that there's a major ascending somatosensory pathway that occupies this white matter strip on the midline. And what ascending somatosensory pathway dominates this area through here? It's the medial meniscus. And those are fibers that are carrying, as you know, information of fine touch, vibration, and proprioception from the contralateral side of the body except fixed. You should also know on the medulla that there's a major ascending somatosensory pathway that's localized in this region. Now, I can't see the exact border, but what major ascending somatosensory pathway is localized in this region on both sides? It's the spinal thalamic tract, right? Also known as the anterolateral system, which is a fine name. And those fibers of the spinal thalamic tract, again, you need to remember, relays information of fine touch and, pain and temperature, and some crude touch from the contralateral side of the body. So that's the spinal thalamic tract. Now, again, here's fourth ventricle. You know that this is over here, an opening out of the fourth ventricle, and so this is the foramen mabushka, or the lateral aperture, so that should tell you that this is a section through the upper part of the medulla. And if it's upper medulla at the level of the inferior colliculus, you should know that at this level, there's an extensive array of nuclei that are associated with the eighth nerve, because this is where the eighth nerve attaches. Now that's actually part of the ninth nerve, but eighth nerve attaches at this level of the inferior of the foramen mabushka. So this represents in here the cochlear nuclear bundle. Cochlear nuclei is good enough. These are secondary neurons of the auditory pathway. And if these are cochlear nuclei, which receive input from the nerve, you might well guess that most of this nuclear area also receives fibers that come from a different division of the nerve. This is part of the vestibular nuclear complex, and it's huge in the floor of the fourth ventricle, in this case in the upper medulla. So again, vestibular nuclear complex, cochlear nuclei. In addition on this slide, from the previous slide, said we should expect to follow downstream the spinal trigeminal nucleus and the spinal trigeminal tract. So spinal trigeminal nucleus, spinal trigeminal tract right through here. Now this is what cerebellar peduncle right here. And this is the inferior cerebellar peduncle. It can also be called the restiform body. So this is slide 12, upper medulla. We go to this next slide. It's slide 11. Clearly, it's still medulla. It's medulla why? Because what do we have right here? Pyramid. It's medulla why? What's this nucleus? Inferior olivary nucleus. If it's medulla, what ascending somatosensory pathway dominates this area through here? Medial meniscus. If it's medulla, what major ascending somatosensory pathway structure is positioned out in here? Spinal thalamic tract. A little bit of the inferior cerebellar peduncle on this side. It's not quite as well formed over here, but right next to the inferior cerebellar peduncle, there's spinal trigeminal tract and spinal trigeminal nucleus. It's a little less clear over here, but that area there is spinal trigeminal nucleus and then spinal trigeminal tract. Again, fourth ventricle. I think on your slide list, I have listed the hypoglossal nucleus, the dorsal motor nucleus of the vagus, and this is still some vestibular nuclear complex. I'm not likely to ask you on this slide, 11, I'm not likely to ask you hypoglossal nucleus, even though I think it shows quite well, there's evidence of axons kind of streaming down in this direction. Or I'm not likely to ask you the dorsal motor movements of the vagus. I told you that, I think, last week in one of the reviews that I did or something like that. In any event, I wouldn't worry too much about the nuclear array in the floor of the fourth ventricle. Just realize all these are cranial nerve, well, not that, but all this area here is cranial nerve nuclei. Okay? Now, the final slide.
Wait, sorry, what's that big one in the top second order?
Top where?
Top right hand of the fourth ventricle.
Oh, right here?
Yeah.
So this is part of the vestibular nuclear complex, mostly. And the dorsal motor nucleus of the vagus is right in here. Okay? Now, out here, I'm pretty sure that this is the lower part of a cochlear movement. I don't have the thing in front of me. I haven't talked about it for years, but I think that's part of the cochlear movement. But this should be mostly vestibular nuclear complex. In here, as I recall, we're starting to pick up some of the lateral communion nucleus. But that's not on your list. Okay? All right. Next slide then. Okay, finally then, in terms of brainstem, this is also the medulla. Okay? And you should know that because of the standard reason. You have a nice pyramid on the left side. On the right side, we're cutting through still a pretty good section through the infraalveolar nuclear complex. You should know by now that there's still medial meniscus in this region here. Spinal columnar tract is out in the lateral position out in here. Now, this cartoon is in here, slide 9. This is slide 9 because this is the level where the fibers that make up this medial meniscus, this is the level at which they originate. They originate from these nuclei back here. These are neurons, secondary neurons of the dorsal column system. The neurons that make up this nucleus closest to midline is what nucleus? Nucleus gracilis. Because in the spinal cord, wouldn't the fasciculus gracilis be localized right in here? And there's still a little bit of fasciculus gracilis out here on the outer edge. So here's nucleus gracilis. Right next to it, this is nucleus what? Cuneatus. And there would still be some fibers of fasciculus cuneatus here. These are secondary neurons of the dorsal column. They send their axons through these arcing fiber arrays right here. And these fibers decussate across midline and form the opposite medial meniscus. Okay? So nucleus gracilis, nucleus cuneatus, and right next to nucleus cuneatus is the spinal trigeminal nucleus. Now we're pretty far low down in the medulla, so this is probably far enough down to call this the pars caudalis of the spinal trigeminal nucleus. And why is the spinal trigeminal nucleus caudalis, this pars caudalis of the spinal trigeminal nucleus, why are these neurons important? Because most of these neurons, many of these neurons are secondary neurons that relay pain information from the ipsilateral phase. Remember that? Okay. And then when you get upstream in the curriculum, all of a sudden I forget his name. A senior moment. Okay. Dr. Lefebvre will expect you to know about this spinal trigeminal nucleus caudalis. So in any event, you should know this nucleus. And right next to it are still fibers of the spinal trigeminal tract. So on this slide, I think I kind of indicated what I consider most important. Now, when we go down to the next slide, clearly we're in spinal cord. And my expectation is you can identify 3 different sections through the spinal cord. Cervical spinal cord, thoracic from lumbar spinal cord. And I'm starting at the top going down. So this is slide 4. This is cervical spinal cord. Remember that in the cervical part of the cord and the lumbar part of the cord, the volume of gray matter will be quite large. The butterfly will be very big. And so we have a large volume of gray matter here. Okay, so we have to be either in the cervical or the lumbosacral enlargement of the cord. And then the next thing I look at is how much white matter. And there's really a thick veneer, a lot of cross-sectional area of white matter. So this has to be high up in the cord, based on what we've said to the cord. So this is cervical spinal cord. You ought to be able to know that. Again, my eye usually wants to orient to ventral and dorsal, and ventral median fissure is one way to do that. Another way is the ventral horns are usually bigger, fatter, wider from medial to lateral. The dorsal horns are usually a little bit thinner, okay, not as wide. So there's several things that help orient you to anterior versus posterior. So here's ventral horn, okay? You really can't make out distinctively that much about the different myeloid that make up the ventral see the great commissure here with the central canal, okay? You can see in the dorsal horn, I think you can roughly see it, the dorsal horn looks to be capping out, ending right about here. On this side, ending right about here. So lamina 1 is out at the tip of the dorsal horn, and next to it should be lamina 2, which is not all that obvious on this slide. So lamina 2 is right in this region. Lamina 2 on this side is right in this region. Now, in addition to gray matter areas, we have white matter areas. So my expectation is that you should know that there is a major ascending somatosensory pathway that fills much of this area through here. And what pathway would that be? The spinal thalamic tract. There's a major ascending somatosensory pathway structure in this region. That's the main one. Now, in addition, you can see, I think, quite clearly that there's a major ascending pathway structure that I'm outlining right here. What's the major ascending pathway structure that makes up most of this area through here? Fasciculus gracilis, and you should know that. In contrast, lateral to fasciculus gracilis, there's another major ascending pathway that fills much of this region through here, and that's what? Fasciculus cuneatus. Remember that fasciculus cuneatus is carrying information like fine touch, vibration, and proprioception in the ipsilateral lower body. The fasciculus gracilis at this level is carrying primarily fine touch and vibration in the ipsilateral lower body, below these things. Now, there is another major ascending somatosensory pathway structure that we talked about that fills much of this region through here. A major ascending somatosensory pathway that fills much of this region here is made up of fibers that make up the dorsal spinal cerebellum. Remember, those are the fibers that originated from the nucleus dorsalis or Clark's nucleus. So that's another major ascending pathway that you should know, I think. Now, in addition, we said that there is an important fiber tract located right here, just off the tip of the dorsal horn. So if I ask you to name the major fiber tract located in this region right here, what would you say? Lissauer's tract? Is that fairly straightforward? Lissauer's tract on both sides. If I ask you to name one major descending motor control pathway that helps to make up this area, what would you tell me? Lateral corticospinal tract is the major one. If you said rubrospinal, that would also work, but we didn't talk about it. Now, if I ask you to name one major descending motor control pathway in this region through here, there's several that you could mention. There's a tectospinal, there's an anterior corticospinal, there's a medial reticulospinal, there's a, I forgot one, descending medial longitudinal fasciculus. If I ask you to name a major descending motor control pathway, in this region here you could name lateral reticulospinal or you could name vestibulospinal. Okay? So again, you should know relatively the names of a couple of these major descending motor control pathways. The other structure that's very important for you to remember, I think, clinically as well as anatomically, is this little sliver of white matter, that dark stained area right here. What structure is made up by this dark stained area right through here? The anterior white commissure. Why is that important? Because this is where the pain and temperature fibers are deposited from one side of the cord to the other. Yes?
So you see there's also a gray commissure?
There's a gray commissure right here, the light stained area, and then just anterior ventricles, there's that dark area right there, and that's the anterior white commissure. Yes, so there's actually two commissures, a white and a gray. Did that answer it? So can I go to the next one?
Yes. What was the major descending lateral or medial?
Oh, I'm sorry. I mean, lateral corticospinal. Yeah, that's really the major descending motor control pathway. Is the lateral corticospinal. There is, again, overlapping with it some nucleospinal fibers, which we haven't talked about. Okay. Next slide, then. Just two more to go. All right. So. This slide, I think with all agree that the volume of gray matter is quite reduced from the previous slide. The butterfly pattern is kind of fat or big in the middle, but the dorsal one very small, ventral one. But look at all the volume of white matter. Okay? Look at the volume of white matter. So this is clearly, I think, thoracic cord. You should be able to tell that it's thoracic cord. And look, if you can tell it's thoracic cord, which you should be able to do, then a couple of unique features should be found on this slide. You might want to remember this. So on thoracic cord, a couple unique features. One is that there's an extra horn in addition to the dorsal and the ventral horn. So there's a little bit of a lateral horn right here. It doesn't show as well over here, but here's lateral horn on this side. On a really good slide of the lateral horn, it'll pouch out about like this. It'll just hang out like a little tip of a finger, the distal phalanx of a finger or something. It's usually much bigger, but this is the slide you put in the atlas. So lateral horn, which is made up of a specific nucleus of lamina 7 called intermedial lateral nucleus, IML, makes up the lateral horn. So if I ask you to name the specific nucleus that makes up this area in this region, the regional lateral horn, it's intermedial lateral nucleus. I don't ask that question very often, but it could be asked, and it could be asked on board exams. So I've asked you to learn that nucleus. Now, another unique nucleus at this level in the thoracic spinal cord is this really big nucleus here. It looks kind of rounded to me here. It's another nucleus. These are also nuclei of lamina 7, and this is Clark's nucleus, or nucleus dorsalis. And we talked about these neurons in the context that they receive primarily proprioceptive input from its lateral lower body, and then they send their axons, follow the streets. They send their axons out over here to form that dorsal spinal cerebellum. Okay, now, in addition on this slide, what dark stain structure is that right there? Anterior white commissure, anterior white commissure. In addition, you should know the major ascending somatosensory pathway that fills much of this area through here. And what pathway is that? I forget. Spinal thalamic tract or anterolateral system. Again, it's tough to ask, I think, Lissauer's tract, but there are Lissauer tract fibers through this territory through here. Now, I wouldn't ask it on this slide because I don't think it's that clearly shown, but there is a slight dorsal intermediate sulcus and septum. So technically there's a fasciculus gracilis here, and there's a fasciculus cuneatus which is starting to form. But again, it doesn't show that well here. It showed best on the previous slide. Now, in addition, getting back to something I asked on the last slide, is name one major descending motor control pathway in this region? Lateral corticospinal tract or rubrospinal. Name a major descending motor control pathway in this region through here. You might be thinking lateral reticulospinal or even vestibulospinal. And then in this region of the white matter, there's usually several descending motor control pathways, including descending medial longitudinal fasciculus, a tectospinal, an anterior corticospinal, and a medial reticulospinal tract. Okay? So again, some major descending motor control pathways. Before we leave the slide real quickly, that should be a no-brainer. What is that right there?
No-brainer.
Dorsal root of the spinal nerve, which hasn't quite attached to the cord here. And what is this right here? It's a ventral root of the spinal nerve, which is already taken off from the cord. Okay? And then the final slide, and by the way, that previous slide, I'm sorry, was number 3. I didn't say that. This is the last slide. Plate number 2. Again, the volume of gray matter is really, really big. So it has to be cervical enlargement or lumbosacral enlargement. But because the volume, the thickness of the white matter is so small, you should be able to tell that this was lumbar cord. And I've told you a couple times at least, maybe several times, that one question would likely be, name the part of the cord that's best represented by this section. And what part of the cord is represented here? I forget already. Lumbar cord. Again, on this kind of a lumbar cord, you can see a big fat ventral horn, you can see a big fat dorsal horn here. And you can see here evidence of what lamina that helps to make up the dorsal horn of the spinal cord grade. Lamina 2, also known as substantial gelatinosis. So lamina 1 is just going to be a thin area out here. You really cannot define the exact border of lamina 1. And then what structure dominates this area through here? Lissauer's tract on that side and here on this side. Again, we see dorsal rootlets of spinal nerve actually attached to the cord. Here we see some ventral rootlets which have already detached from the cord. And then what major ascending somatosensory pathway would occupy a position through here? Major ascending somatosensory pathway? Spinal thalamic tract. There would still be lateral corticospinal tract and some rubrospinal tract in here. There would be some descending motor control pathways displayed through these regions that we talked about on the previous 2 slides. Now here, in this dorsal part of the cord, right, fiber tract that dominates this area through here. And what fiber tract, what ascending pathway structure dominates this area through here? Fasciculus gracilis. And are those are the axons that make up fasciculus gracilis? Are those axons of primary sensory neurons or secondary sensory neurons? Primary sensory neurons. The current cell bodies of these axons, remember, are out here in a DRG somewhere down below this level. Because these fibers are primary sensory fibers carrying fine touch vibration and proprioception from the ipsilateral lower part of the body. Okay? So in any event, the exam on the slides, on Thursday, I think you have a schedule of events, I think it starts at 12:30. Be 20 questions. Most all those questions will be simply name the structure. Okay? And I'm looking to test your basic minimal competence. Okay? That's it.